you. Good evening, everybody. I thank the organizers for giving me this opportunity to share the work and thoughts on artificial intelligence in autism spectrum disorders and other neurodevelopmental disorders. Am I audible and are my slides visible?
Yes, ma'am.
Okay, thank you. I have no known disclosures. How I plan to keep my thought is what is AI we are talking about, role of AI overall in the neurodevelopmental disorders, autism, ADHD, cerebral palsy, epilepsy, specific learning disability, hearing and vision impairment, neuromuscular disorders, and what are the ethical concerns and limitations, if at all, and what is our experience. So it is in practical also how much it's available and how much we need to collaborate between various sectors of a society with different scientists from various domains to get along, the technology and the clinicians to get along to move ahead. Artificial intelligence is simulation of human intelligence in machines. Machine that exhibit traits associated with human mind, such as learning and problem solving. There is something called artificial intelligence and something called augmented intelligence. Currently, what we are talking about is machine aiding human resources, the augmented intelligence. Machine replacing human processes will come subsequently. Certain concepts in AI need to be clear, that there has to be ability to rationalize, ability to take actions that have the best chance of achieving a specific goal, and machine learning as computer programs that automatically learn from and adapt to new data. Machine learning is a subset of AI. Deep learning is a subset of machine learning that has techniques that enable this automatic learning through absorption of huge amount of unstructured data like text, images, and videos. So deep learning is a subset of machine learning, which is a subset of AI. AI can be used in various areas of healthcare, from drug development, mental diagnostic and treatments, virtual nursing assistant, fraud detection, cybersecurity, gene edited, and AI robot assisted surgery, and health monitoring and wearables. So it can cover in various domains. So my area of interest is autism and other neurodevelopment disorders. So where can artificial intelligence help us? Neurodevelopmental disorders are those which have impairment in growth and development of the central nervous system and encompass so many conditions written on the slide, including autism and learning disorders and epilepsy and cerebral palsy and many more. I want to mention to you that they are very common. The only prevalence study which is there in India we had done in 2011, which showed that 12% of children in the age group of 2 to 9 years had one or more neurodevelopmental disorders, and 21.8% of them had more than one neurodevelopmental disorders, meaning comorbidities. And that time, the data collected in 2011 had the census of also that year, and 173 million children in the year 2011 were in the age group of 2 to 9 years. Extrapolating this 12% becomes around 23 million children. And most of these conditions last across a lifespan. So look at the number of persons who can be affected by this and who will be benefited by all this. So it is very important that we move ahead with technology. And that year, the autism prevalence, we found was 1 in 89. And now, currently, autism prevalence of last year from CDC USA is 1 in 36. Coming to the AI enabled personalized assistive technology, which have been used for neurodevelopment disorders, maximum work has been done for autism. Next has been done for dyslexia, and after that is for ADHD. Coming to autism spectrum disorder, this shows the various countries where the research has been known, and which is obviously not much has been done in India, and the number of journals in which they have published, and the number of publications which have increased in the last decade on autism and artificial intelligence. How can artificial intelligence be used in AS? So there are few things, we reviewed the PubMed search I had done for last 10 years, and from over 2.25 lakh articles, we finally had studied 74 after reviewing in detail. AI can be used if you are using the older diagnostic tools and taking help of AI to improve. Second would be AI using new novel diagnostic aids. Number three would be the intervention part. So AI in older diagnostic tools is like there are certain tools which have been there like ADIR and social responsive scales. These scales have been used by machine learning. They have found out, they developed algorithms and found out certain data points which can have improved the sensitivity and specificity of these tools, and simultaneously reducing the duration of time for applying these tools. Similarly, it has been done for ADOS itself, which is actually supposed to be a gold standard globally. There has also been, this has also been done for the Mullins and VABs, trying to understand in these children for autism spectrum disorders. So Mullins scale of early learning and VABs, Winland adaptive behavior scale also, similar thing has been done. This was an article in which 13 studies were taken in which older tools which have been there to diagnose autism, they used AI algorithms to identify assessment instruments which were most predictive of autism spectrum disorder, as I mentioned. So this has become useful. Second part is developing newer diagnostic tools and aids. So they have developed, an AI-based software as a medical device to aid primary care health providers in diagnosing autism. So this has got good sensitivity and specificity. So they have also been studies on mobile detection of autism through machine learning on home videos. So that is how in this study they have done, and they have evaluated 100 odd behaviors and found that the accuracy can be improved without compromising on the specificity. This CognoEye is the AI-aided diagnosis and autism screening tool, and this was made in California, and this has been the first FDA-approved screener for autism spectrum disorder. It has got a 4-minute parent report questionnaire delivered via a mobile app and list of key behaviors identified from a 2-minute semi-structured home videos of these children. So this was approved in June 2021, marketed as the first diagnostic aid for autism spectrum disorder approved by of FDA for AI based. Next comes to eye tracking. A lot of work has gone in eye tracking, and a lot of meta-analysis have shown that these children have increased gaze to less relevant areas of the face. In that ways, they have been showing that typically developing children spend more time looking at the right eye, but autism children look more in the left eye. And we are helping by using machine learning aids, eye tracking data. Autism spectrum disorder has been picked up early, and that is how it is going on. So it is being picked up, especially in preschool age children, and also especially for those who are siblings of children with autism spectrum disorder. This is another next step is that computational methods have been done to see the gaze pattern in toddlers with autism spectrum disorder. They have been found to have distinctive eye gaze patterns, which are characterized by reduced attention to social stimuli and deficits in coordinating gaze with speech sounds. Behavior imaging. This is one, software which has been developed by Yahoo company, in which naturalistic observation diagnostic assessment is based on. There's a home screen, and they keep observing the child, and based on that behavior imaging, it has been used. Then coming to other things like fMRI, that they have done studies in which they are using fMRI and trying to see how you can pick it up early. The genomic insights and advanced machine learning has been also seen. See, autism spectrum disorder has certain genetic predisposition, certain environmental factors, and certain epigenetic factors. So this genomic insights and advanced machine learning is helped to characterize autism spectrum disorders based on biomarkers which are being studied and the genetic interactions thereof. because the most important I feel is the epigenetics, where you have the various methylation defects and all. There may be the game changer and basically therapeutic intervention targets, and also the environmental factors which are preventable, like exposure to air pollutants in third trimester of pregnancy, pesticides, and all that. So basically, what this study has done, in this study, they have seen the genomic insights and seen the various biomarkers and genetic interactions, and they have detected some 1,286 SLPs. Next comes the AI-based interventions. Combining AI and behavior activation has been shown that it improves their behavior interventions. This is a superpower glass intervention deployed by using a Google Glass and a smartphone app. It has shown that it promotes recognition and relevance of emotion in the child's natural setting. The display allows colors and emoticons to be seen by the child with their peripheral field of view. And they have used that, for face tracking and emotion detection. Then Florio is another VR activity performance can be, through a VR activity and performance, you can improve the learning in these children, so that you can pair an app so that a supervising parent or a professional, either via in person or via telehealth, or the data going through cloud, the child can see be how the child is reacting to this VIR or any puppeteer characters, that can be given guidance to the parents as well as the therapist of how to interact with these children. Coming to another robot, which is a semi-autonomous parrot-inspired robot, Pilicro, that is being used to train in facial expressions in these children. Then, there are a lot of robots, there are different kinds of robots which have been used. We have been working on this now, humanoid robots, and they have been they certain, they have been home-based videos, they have home-based interactions of these social robots for social attention, sensory and negative repetitive behaviors, social communications. So humanoid robots have a collaborative play behavior, but some of these children interact well with robots, not with humans. But they will improve, they have been shown to improve, but a concern remains whether this child robot interaction will later on go on could be transferred into a human to human interaction. So this SoftBank robots, the Naya humanoid robots have been done. They have shown that their children are capable, of interacting with them. They respond more to them sometimes, but the results have still, long way to go before it comes into practice. And other thing is very expensive as of now. This is a QT robot which is there for increasing social learning for these children. They have been given more effective teaching lessons with the help of QT robot. Babley is another robot which has been used in talking to children which have challenging behaviors and challenging interactions. So many children with autism and anxiety disorder find it easier to talk to a screen or a robot. Again, that it is there in the long run, whether the whatever the child is interacting, that can be shared by the therapist and the parents and can be helpful. So this is a social skill training robots. There is a robot facility program which is made to improve the social skills of these children. And there are also robot models for appropriate social based behavior. So this was a systematic review of 240 papers, and they have found that robots have been mainly added as entertainment agent to elicit greater engagement from participants, and might not be as of now ready to actually deliver high-end care. So this show, but the social robots, they have shown that these have improved the robot mediatic interventions have improved their social functioning, and they are greater benefits in smaller children. They also developed some apps for helping these children with autism to overcome their anxiety, depression, hyperactivity, general stress, and more. And I must say that, most of these conditions have comorbidities, but, in autism, like we recently analyzed the data of 1,874 children with autism and found that 80% had comorbidities. So when you're effectively managing a child, you'll have to look at all the comorbidities as well. So these apps have been developed and which help to follow them up and track their progress. This is AI has also helped in one way, that they have used in potential identification of vitamin B6 responsive group of children who have particular genetic phenotypes. Then Also, they are trying to identify various comorbidities, like they are trying to study dyslipidemias in children with autism. So we can also study various comorbidities in these children. But robots are very expensive. Those children who will be able to follow instructions and read are only going to interact. Those who are very severely affected, having cognitive impairment, will not be able to do that. So you need to have some amount of level of functioning and motivation for these children. And we do not know whether this child robot intervention is going to form into a human interaction. Yes, their interaction with the robots will help and guide the therapist and the parents to handle, but whether there will be a direct corollary, we do not know. And machine learning is trying to come in a big way. So there has been certain, it is enhancing the objectivity, and you have to go on seeing. And there are a lot of studies which have gone on. This review paper has reviewed 60 studies done on deep learning, and there are various things, some of them on eye gaze, some on facial description, the expression, the motor skills, EG, fMRI, multimodal. So basically, identifying the behavior and biological markers for diagnosing has been one area. Assistive technology and existing protocols for follow-up have been found out as three key areas in this paper. So this was a brief bird's eye view of what is happening in the most happening field of autism, which is actually coming out as a silent epidemic, and in the now prevalence is on the rise from 1 in 157 in the early 2000s, now in 1 in 36 last year on 26 March 2023 by CDC. It is becoming and emerging as a global public health problem. Coming to ADHD, when I had review articles for 10 years, we did come out for 106 articles and then ultimately reviewed 22. And you can have artificial intelligence in ADHD. It can help in autism, in ADHD diagnosis. However, there is still scarcity of literature how it's going to be treating them. So basically on diagnosis, it can be done. More work has been done. These are bar charts, are the studies, AI-based studies on ADHD diagnosis over the last couple of years. So what they have done, there is a software they have developed, pediatric attention deficit hyperactivity disorder application software, and which they have tried to see how they have developed a tablet-based game which gathered a real-time user data, and then they could understand and predict development of ADHD and compare them with non-ADHD. Similarly, a lot of data is being, there are a lot of studies being done and data being analyzed about picking them early using fMRI. So the most pronounced differences in ADHD and healthy have been observed in frontal lobe, temporal lobe, occipital, and insular lobe. And they found in this study that they could have a ADHD prediction accuracy of 90%. So that is still research going on. Same thing has been based on continuous mental task quantitative EEG, and that has been used, being portrayed as an assistive tool for diagnosis of ADHD children by with the help of these kind of tools. The studies have also shown similarly with electrooculography with visual stimulus tracking and also with electrophysiological brain changes. And they have some been prediction models which have been developed. They have developed personal wearable devices with the help of which they have found the ADHD sleep problems in these children. So ML based methods for screening and picking them up is increasing. Recently in this paper, they had studied the hybrid approach in which you have a machine learning model obtained by training on the data of the past cases plus the clinical experience of the faculty. So the resulting algorithm, keeping both of them together, increased the accuracy to 95%. This is a NeuroSky is another device. It is this is got developed in 2004. It detects the attention levels in assessment exercises and combines the performance data with the user generated data. So there is another one. They have done a review on automated detection of ASD, and they found that many tools like MRI, EEG questionnaires, motion data, performance tests have been used, and also with wearable devices, as I've mentioned. So these things are coming up in a big way. So we may be able to pick them up early. That is the status of ADHD. Coming to cerebral palsy. Cerebral palsy also, when he had reviewed the 10-year data, there were lesser number of papers, yes. And something important which is coming up in cerebral palsy, general movement assessment. So general movement assessment, a lot of work has been done, and they have said that depending on the type of general movement assessment and having a video recording of the general movement assessment and getting analyzed, and that could be a good screening tool for classification of these children to fidgety and non-fidgety movements, and have a prediction risk for development of evolution of cerebral palsy or so. So they're using deep learning and artificial intelligence also based on some blood-based DNA epigenomic prediction model in which various methylated foci have been seen. So, and the movement is general movement, I told you, through machine learning, having a camera-based solutions and the body-worn miniature movement sensors. They're trying to find out whether high-risk newborns, when you follow up very closely, then we will be able to pick them up very early. So there are a lot of studies which are going on with the video-based infant motions tracker. So lots of work in this, and also there's efficiency of the GMFM scales to evaluate these children as on. Also, there has been certain videos for movement disorders like dystonia and all, which comes in dyskinetic CP. So that is also there. Now coming to robotics, in that robotics will be basically for their gait training and all, and the level of support will depend on the weakness of the child. Maybe minor support to major walker robotic platforms can be there, and they can be, this is robot assisted gait training in spastic. CP has shown to be beneficial, and there is also that, comparing the robot assisted gait therapy versus treadmill training has shown to be better in these children. When you need longer studies, so you may have robots which will help in mobility, you may have virtual reality systems, you may have augmented alternative communication systems in non-verbal children, you may have self-care robots, you may have mobile applications to guide these children. So there is so much work going on, and where we can use technology, and keeping in mind many of these conditions are coexisting. Regarding epilepsy, yes, there are articles which have been working on the various aspects, and 50 million people in the world are suffering from epilepsy. However, the analysis of EEG record through visual inspection is tedious and cumbersome. So there are some machine and deep learning models which are based on the EEG and which are being developed so as to pick up early. Having ambulatory seizure monitoring, having the identification of start of seizure, stopping of seizure, trying to understand what are the neural networks which are there, trying to prognosticate children based on the these models on EEG. So basically, artificial intelligence and computational processes have been used to possibly link and get personalized care, because with the medical data, the EEG data, the MRI data, correlating all of them and trying to give a personalized medical care. So that is how it is coming up in, like, many, like this study was on temporal lobe epilepsy. They're saying that AI may help us in decision making, help us in prognosticating these patients, and they were trying to understand the long-term outcome. So there are lots of aspects where it can be working, whether in diagnosis, seizure detection and prediction, outcome prediction, and treatment algorithms. So there's a lot of scope. Coming to specific learning disorder, in that also certain number of papers are there, and they are trying to identify these children early by working on the various interactive biological pathways. Their white matter connectivity issue, there is, they are trying to have a game-based techniques in which they are trying to have a reading writing test, facial image capture, eye tracking, MRI, fMRI, quantitative EEG. So they are developing some screening tools so as to pick them up early. There are certain interactive multimedia screeners for SLD, and also for prediction for them. The eye tracking can be used. Some child who is having dyslexia versus a child who has a problem, no problem in reading and writing. The eye tracking is very different. So there is a lot of things happening with fMRI as well. There is a sort of fuzzy cognitive map which is there. So there is lot of work and lot of computational diagnosis, and to diagnose these children, and automatic feedbacks are there, trying to pick them up early first, and then automatic feedbacks for teaching them, and intervention is there From intervention based things, there are certain computer based speech therapy programs and other programs which are there, and there are certain many devices which are available to help these children for SLD. Then similarly, you have for hearing and speech impairment, you may have AI driven approaches for hearing technologies, and there are a lot of work being done, and your hearing aids are going to be having machine learning driven by the users. So you may have deep learning models for hearing aids. You may have for machine learning for the vestibular functions. Same thing for various machine learning models are going to be there for sensory neural hearing loss, to understand which of these children are going to be improved by a cochlear implant. Like you have EEG, you have a ABR waveform. The AI can help you assess these ABR waveforms, and that is something very important. Cochlear implants can be refined to have a quick and efficient results, how to, what are the indications, and how you improve the speech in these patients. And the speech generating devices are also there, depending on the condition the child has, whether he's autistic or cerebral palsy, what is the cognitive level. There's so many AI based devices which are coming up in a way. Alternative augmentative communication has to be kept in mind, and speech recognition software is being developed using a brain computer interface research. So this is a long way, many things to be done. Briefly mentioning one or two other things is visual impairment. They are their thing is very important, trying to pick up from retinal photographs, trying to understand the deep learning algorithms, studying the ROP, retinopathy of prematurity, lots of things coming up. For neuromuscular disorders, you can have things to pick them up early, yes, and also try to give him a postural control, robotic gait training. They can be done and followed up very closely. You have robotic exoskeletons and BCI, virtual augmented reality. All of them can be tried, and a lot of work is going on various aspects. And some of them are also following the long term of these patients, long term follow up of each individual patient, and try to guide them. So this is something which is very important. Same thing for SMA and peripheral neuropathy. But the limitation is you need for large high resolution data sets. If you're having imbalanced data sets, we do not know of the generalizability. The lack of evidence-based guidelines and variations of care. There is a developmental variation in a child who is a neonate from 0 to 18 years, and there may be disparities on care in different models. There may be some ethical issues involved, there may be medical legal issues involved. For example, in a virtual reality game, you have a ball coming and hitting the child. The ball will not hit the child in a virtual reality way, but if it is in the real world, the ball will hit the child. So we do not know if the child will understand fear after being trained in a virtual reality. So we do not know. There is lot of cost involved. There is so much of information loss. So your current research, what we have been doing is we have developed through machine learning based, we have made smartphone based games for improving the prediction skill of these children, prediction to time and space. We added digital elements in augmented reality. This is a virtual reality joint attention training platform for these children. These are also augmented reality joint attention training platform. This we have made as a center of excellence part. We have and collaborating with IIT Delhi. Then with the collaboration with University of Reading, and we have developed this screening tool for autism risk using technology, in which eyes tracking and many other things and video recording of parent and child interaction is involved. This is all ready and available. Then while I'm reviewing the various digital elements, tools which are being used, there's a lot of work which needs to be done. We are not sure about the evidence for each one of them. That is something very, very important. And the point is that, like attention control in autism, we have developed this eye tracker along with the University of Birkbeck, and which is there. For dyslexia, we developed a dyslexia remedial intervention program. Then we validated it, and we found on fMRI that post minus there were improvement in the post fMRI versus the pre fMRI. Then we developed into a AI based this was like a post minus pre, there was improvement in areas under fMRI. Then we have developed a AI based remedial intervention program, which is available on www.readable.com, and this is shown on fMRI that it improves the language networks. So we will be bringing out this we worked out, and we were as a part of the Center of Excellence thing, and with IIT Delhi, we are trying to make it into a using as a standard of care. Now we are comparing this and adding transcranial magnetic stimulation as well. So we are making this as a standard of care. Working with Triple IIT Delhi, we have tried to understand with humanoid robots the interaction of these children, and this was recently published, presented in INSAR last year. With IIT Delhi, we are developing an automated gait assessment report for these children with cerebral palsy. Along with CDAC Delhi, we are working on a brain-computer interface browser for communication in these children with special needs, and also developing virtual reception. And we are also trying to integrate in an AI-based platform the screening tools, the diagnostic tools, and the interventions for these patients. And trying to work with the All India Councils for Robotic and Automation also for the same. The future of AI is going to be going towards more and more super intelligence and machine consciousness. But they cannot replace the humans. We have to keep those ethics in mind. This is my institute on a bright sunny day. This is the institute on the foundation day, and this is the Ames Lit Blue on Autism Awareness Month. And this is my team. So because no work is done by an individual, it is the whole team which matters, and the support from the institute which makes it, all the support which we get from our director and the institute and everybody. And really grateful to all the patients who have reposed faith in us to allow us to do studies and research, and they've been part of our trials. Thank you so much for the opportunity. I'd be happy to answer any questions.
Thank you.
Long live India and France friendship.